Good morning. I'm again BC Mole with you this morning to give you some exercises about back pain. Back pain is the most commonest pain ever seen. There are several factors for back pain. It could be a back strain, that is by sudden lifting of something heavy, or which could progress to a disc protrusion, again by lifting something heavy. And it could also result from some kind of accidents or injuries where you have fractured bones, severely injured muscles. But today I'm just going to tell you when there is a sudden ache at the back one fine morning and you do not know the cause. There is no history of lifting something and your back hurts and you do not know what to do other than to run to an emergency. So let me tell you, what are we going to do for that? First of all, for any pain, make sure where you lie down or take rest is a moderately hard surface which would ease your back. As soon as the pain begins, the first aid for back strain or a sudden back pain is nothing but application of ice. So now how do you apply ice? You don't have an ice pack at home, but you have some ice cubes, which is the right remedy for you. All that you need to do is put some ice cube into a plastic bag and pour 1 glass of water into it. This would help you mold to the surface where it is hurting. Often seen, the back pain is onto one side, either right or left, and you are unable to move. So make sure the plastic bag is tightened properly and fixed onto the area where there is pain. You need not sit down to apply ice, however you may lie down on the bed and apply ice. Prior to the application of ice, just apply some moisturizer cream to prevent any ice burn and apply the ice for 20 minutes. Over a day's duration, apply ice 3 to 4 times for 20 minutes each. This would be the first aid for back strain. Now, let us see what exercises could be taught to a patient who comes with a back strain. There we go. The patient is told to lie down. The patient cannot lie down like this, so let him take his own position. He lies down. The most simple thing to do is, after the application of ice, something like this where I am keeping my hand for 20 minutes, ask him to bend his knees. At each step, ask his comfort level, whether it is hurting him or not. This position should not often hurt the patient, or he can tolerate the pain. Ask him to keep breathing in and out. You, as a therapist, will lift his leg towards him. With each movement progressing towards his chest, like this. And hold it for 10 counts. With the patient breathing in and out. This would help giving a stretch to all the muscles of the back, and this would be very relaxing. Repeat this for 10 times. Once the side affected is done, always make sure you also do for the side which is unaffected, like this. You bring it towards his chest. Let the patient not contract and let The patient just hold according to his comfort zone, either in his thighs or in his knees if he doesn't have any knee pain. Bringing it closer to his chest. Again, the patient will feel a stretch all over his muscles. And keep asking the patient, what does he feel? Once this is done, for 10 repetitions, let the patient breathe in and out. Progress diagonally, the same exercise. So you as a therapist will lift his leg and move it diagonally towards the opposite shoulder. His knee would be towards his opposite shoulder. Something like this. If for you it is heavy to lift, cross his leg towards the other side and then give a force from here and push. This would actually stretch these muscles. If you need more stretch of the lateral flexors of the back, do this. This becomes a progressive exercise. Let me show you again. Let me repeat it for you. The first one is this. Just lift towards his chest, bring it down. The next one is just to place his knees diagonal to his shoulder, opposite shoulder, something like this. If it's too heavy, cross his leg, push it this way towards his opposite shoulder. Further, if you want to stretch, just let the whole back tilt onto the other side and stretch. And hold it for 10 counts and breathe. This would give a complete stretch which is very relaxing. I would suggest after this exercise, try to apply a hot pack instead of cold pack and advise the patient to apply cold pack at home. I would suggest all the physiotherapists should try these exercises and let me know your results. All the best and good day.